So in my last video, we talked about tight hamstrings, but now you might be wondering, okay, well, how does my tight hamstring play on my tight calves or my ankle immobility? Hey, it's Dr. Heather, and actually that's something that we want to address a little bit further because again, if you have tight hamstrings and if you have that posterior tilt, which we just addressed in the hamstring video, you may be susceptible to more tight calves, which you might be noticing more in your activities. It could be your lifting, it could be your running, it even could be with cycling. So now we want to really address that. Now, as always, if you want more in-depth information regarding how to do more myofascial work, I want you guys to go ahead, check out my myofascial course because that's where I go more in depth. So now for more information, click down below into the description box and you can head over to that course. So now what we want to do is really look at how do we address these tight calves. So we're going to go step by step through an actual protocol. So the first thing we want to do when we address our tight calves is actually work on the soft tissue. And like I said, if you want to go more in depth into the soft tissue, check out my myofascial course. Head over there where we really take a head to toe approach and looking at everything that's going on with the tissue. But first, we're going to just simply address our calves. Now, I'm jumping right into the massage ball versus actually going into the foam rolling first, because now what I want to do is I want to use that massage ball to kind of actually not just get into the gastroc muscle itself, but I also want to use it to get into my soleus and my tibialis anterior. My tibialis posterior. So I'm going to come down onto the ground, and what I'm going to do is I'm going to actually place the ball right onto my calf here, as you can see. Now, what I'm going to do is I have my opposite leg bent, so this way I can allow for good, strong pressure into my calf. Now, if your calf is really tight, you may just wind up holding the position here. And you might want to go ahead and try to kind of actually bring it over onto the inside, starting to get into that soleus a little bit more, and then shifting a little bit more onto the outside to get into those perineals as well. But if you can, what you want to do is actually lift your body weight up off the floor and go ahead and start to really allow for that ball to drive all the way into that tissue. And again, notice that I'm actually going kind of slow because I'm trying to get into all the sections of that lower leg right here. So now once we've broken up the tissue, we do want to go ahead and we want to stretch out the calf. Now, just like we did in the hamstring video, you're going to want to go ahead, get your heel really up high, as much as you can. So applying what we call dorsiflexion, bringing the toes towards you. You could use a banister at home. You could use the stairs at home. What you want to do is actually get a good solid surface, bring the sole of the foot up high, up against it. Now, don't leave your tush out behind. You actually want to bring that body, that pelvis kind of underneath you. You're going to hold here, really allow for that body, and you can see it on me, kind of come into it. I'm using the pole here to allow myself to apply some additional pressure to really get that calf nice and stretched out. Once I feel that stretch here, what I want to do then is I want to go back to my foam rolling, back to my massage ball, dig out the tissue again, and repeat the stretch. I want to do that at least 3 times to really go ahead and get that calf relaxed. Now, from there, once the calf is really relaxed, what we're going to want to do is we're going to want to walk on our toes and our heels. Now, you might be saying, okay, I get, walking on the toes, I'm going to start strengthening the calf, but why would I actually want to walk on my heels? Well, if our calf is taking a front load of the work, it might mean also too that we have decreased range of motion when it comes to dorsiflexion, and that's bringing the toes towards the head. So what we would want to do is walk on our toes and walk on our heels for the length of the room. So again, here it is, I'm walking on my toes, and then I'm going to go ahead and I'm going to walk on my heels. And notice, I have really good dorsiflexion, and for a lot of you, you may actually not have very good dorsiflexion. Now, this isn't just something you would want to do if you're a runner, but if you're also a weightlifter, because ankle flexion comes into play when you're doing weight training as well. So what I would want to do is here, again, break down the tissue, stretch it out, repeat 3 times. Then I would want to do my strengthening, but then at the end, I would want to follow up with breaking down the tissue and stretching it out once more. And like always, if you guys have specific questions regarding your tight calves or even your tight hamstrings, do go ahead, send me a note, because you can get a free consult with me where we can address these issues and we can really look at your overall performance. And as always, if you found some great value in this video, give it a like. And if you haven't subscribed to the channel, go ahead and do so. All right, everyone, I'll see you in the next video.